And we bring in infectious diseases specialist Dr. Isaac Bogoch live this time. Thank you for taking the time to be with us. I'd love to get your take, given the WHO declaration and the spike of MPOX cases in Toronto. How concerned are you right now?
You know, it's something that I think needs to be watched very closely, not just on a global level, but even here in Canada. As was mentioned in the prior report, the epidemic in Canada is almost exclusively in the men who have sex with men community. And again, said with no moralization and no stigmatization and no value judgment. It's just important to note who's impacted so that there can be a targeted public health response. And there is. You know, the vaccine rollout and the communications has been very, very targeted in Canada because that community is disproportionately impacted.
Why do you think we're seeing this spike in Toronto?
You know, I think it's August. It follows Pride Month. There were probably, a lot of close contact and exposures during Pride Month. It also brings lots of people into the city as well. So I think it would most likely be related to that. But I think it's important that we keep an open mind as well, that there might be other factors involved as well.
Certainly, as mentioned in the report, I mean, there is a vaccine. There's a lot we can do with regards to this. What should Canada and other Western nations be doing right now, and given this declaration by the WHO?
Yeah, there's two things, thinking locally and then thinking globally. While we think locally, I think it's extremely important that we care for the population that is disproportionately impacted by this, and that means lowering barriers, reducing stigma, and ensuring anyone who has risk factors for MPOX has access to the vaccine. And really in Canada, that's sex workers and men who have sex with men who are having multiple sexual partners. Pretty straightforward. Globally, it's a little more challenging because a lot of these countries that are seeing a significant rise in cases don't have the same diagnostic capacity, healthcare capacity, public health capacity that we do. And it's really important that we help coordinate and facilitate and work with the countries impacted to see, A, what are their needs and wants, and B, listening to them and facilitating that. If that means they want some of our vaccines, great, they can have them. Of course, there's regulatory and logistical hurdles that need to be overcome. But I think with this declaration, you're going to see a much more coordinated international effort. And that's obviously a smart approach.
Doctor, do you also think there's just straight up vaccine fatigue given the pandemic and all the rounds of COVID vaccine that people took, that they're just not thinking about this sort of thing?
So here's a total biased answer. And I appreciate that if you line up 10 people, you're going to get 10 different answers here. But I think in Canada, among the men who have sex with men community, there was tremendous leadership at the community level. And they did an incredible job in getting the word out, in telling and talking to people and listening to people, in getting these vaccine clinics into areas where men who have sex with men who have risk factors for MPOX would be comfortable in going, and lowering stigma. And again, my bias, I don't have data to back this up, but I think the uptake of vaccine was pretty good. And I think it continues to be when people are aware if they have risk factors. But again, I can't point to data to drive that. That's just my observation and experience. And certainly I care for patients with this infection, and I care for patients who are readily accepting the vaccine if they have risk factors.
Well, that is good to hear. And you right now are getting the word out. Dr. Isaac Bogoch, great to pick your brain on this. Thank you.
My pleasure. Have a great day.